Hello everyone. In this video, I'm introducing to you nutrition in emergencies. And this is one of the major course units covered in nutrition. Nutrition in emergencies provides insights on how emergency situations and nutrition actions can be planned and executed to save life and to provide sustainable livelihood support to affected and vulnerable communities. It mainly involves rapid screening and prioritization of nutrition support and action to communities in crisis. It also explores associated risks to health in an emergency due to the lack of safe drinking water and disease transmission that is mainly caused by poor sanitation and hygienic practices. This course will go further to examine the distinctive differences between the relief food, food aid, and humanitarian support and the various actors involved in the emergency. So by the end of this course, the participants should be able to define an emergency situation, the classification of emergencies, the causes and associated risks. Should also be able to elaborate on the nutrition challenges associated with emergencies and distinguish the types and the contexts of relief food, food aid, and humanitarian support. Furthermore, the students should be able to explain the nature of and the threats posed by environmental diseases and the links between water, sanitation, and health. They should also be able to design rapid assessment protocols for emergency situations and assess how food is used as a political tool and weapon in disasters, and also go ahead to advocate for the rights of vulnerable persons and groups in emergencies-prone areas, and apply the sphere minimum humanitarian standards in humanitarian response in emergency response. Overview to nutrition in emergency. The concepts that we apply in nutrition in emergency are the same contexts applied in normal nutrition setups. However, there are just a few differences. For example, the magnitude is usually higher as the number of people affected in emergencies are more than those in non-emergency situations. The affected populations in an emergency also have minimal or don't even have coping strategies and so are wholly dependent on relief. And there are other concerns that sometimes arise in emergency situations, apart from the nutrition issues that may need to be addressed. And these ones can directly or indirectly affect nutrition. And some of these concerns may include psychological issues resulting from the death of a loved one, rape cases, loss of property, destruction of houses, loss of food items, lack of food, and then the lack of non-food items, for example, shelter. Hygiene and sanitation concerns are also very, very critical during emergencies. Introduction to nutrition in emergency. What is an emergency? In general, we characterize emergencies in these definitions. For example, you can say an emergency is an extraordinary, urgent, and sudden situation resulting in significant destruction and loss of or threat to lives. The term complex emergency has also been used in recent years to refer to a major humanitarian crisis of a multi-causal, essentially political nature that requires a system-wide response. Nutrition emergencies are primarily caused by severe shortages of food, which are combined with disease epidemics. Underlying factors, for example, poor care and feeding practices, insufficient access to health care, and an unsafe environment may all also contribute to an emergency situation. A variety of classification systems, both at national, regional, and global levels, have been developed to classify the severity of a food and nutrition crisis. And all these classifications suggest that emergencies can be divided into progressive stages. According to experts, it's very difficult to set generic thresholds for mortality and acute malnutrition in order to gauge the severity of a crisis. And the classification of a situation is not prescriptive and usually needs to be used relative to local circumstances. The current recommendations consider overall trends in global acute malnutrition and severe acute malnutrition as part of a thorough situation analysis, which takes into account the context rather than waiting until a certain threshold has been reached. So what are the characteristics of an emergency? So we are going to characterize emergency according to the various definitions that we have for what an emergency is. For example, any situation where there is an exceptional and widespread threat to life, health, and basic subsistence, and it is beyond the coping capacity of individuals and the community, may be referred to as an emergency. So this can be a general characteristics of an emergency. Also, relatively acute situations that affect large civilian populations, usually involving a combination of war or civil strife, food shortages, and population displacement, result in significant excess in mortality. So this can also characterize an emergency. Manifestation of an emergency. The various emergencies differ in terms of length, that is short-term and chronic, and then in terms of cause, natural, conflict-related, economic, political, and also complex. The impact, the level of destruction of infrastructure, agricultural, health, and social systems. Affected groups, internally displaced persons, refugees, and stable populations. Humanitarian response. We have huge response and no response at all. So all these can be the various emergencies that may differ from one another. Where do nutritional emergencies occur? Historically, the largest famines in terms of excess deaths have occurred in Asia, although Africa has also suffered more frequent famines. And this is all attributed to recurrent wars and civil strifes. The distribution of acute malnutrition by country suggests that most nutritional emergencies are chronic and invisible. That is, they are not declared publicly as emergencies. In fact, the average level of wasting in South Asia suggests that South Asia is in a constant state of acute food and livelihood crisis and requires emergency nutrition interventions. Emergencies where acute malnutrition rates rise are usually directly caused by severe shortages of food combined with disease epidemics. And some populations are vulnerable as a result of underlying factors, for example, poverty, urban pressures, climate change, chronic food insecurity, and poor infrastructure. And also where there is underlying vulnerability, sudden events, for example, natural disasters, conflict, political crisis, economic shocks, and food price increases can also trigger a nutrition emergency. These are some of the various causes of nutrition emergencies. Severe shortages of food. These are combined with disease epidemics, poverty, chronic food insecurity, poor infrastructure, HIV and AIDS, global climate change, natural disasters, conflict, political crisis, and economic shocks. All these attribute to nutrition emergencies. Who are the most nutritionally vulnerable in emergencies? The population groups that are most nutritionally vulnerable in emergencies can be categorized according to their physiological vulnerability. For example, the young children, the pregnant and lactating women, older people, the disabled, and people living with chronic illness, for example, HIV and AIDS. And then we also have geographical vulnerability. For example, people living in drought or flood-prone areas or in areas of conflict. political vulnerability, for example, oppressed populations, and then internal displacement and refugee status, those who have fled with few resources. Malnutrition in emergency settings. Malnutrition is a broad term that refers to both undernutrition and overnutrition. And individuals that are undernourished or malnourished suffer from undernutrition if their diet does not provide them with adequate quantity and quality of food, or if they cannot fully utilize the food that they eat due to illness. So we have three types of undernutrition. That is acute malnutrition, where there is rapid loss due to illness or inadequate consumption of food, or nutritional edema. Then we have chronic malnutrition. This is manifested by inhibited growth in height and cognitive development, which is caused by poor nutrition over a period of time. And then micronutrient malnutrition, resulting from a deficiency in one or more micronutrients. And this is usually referred to as hidden hunger. The types of malnutrition occurring in emergencies. The largest nutrition concerns in emergencies are acute malnutrition, manifested by wasting and edema, and then micronutrient deficiency diseases. Particularly, we have iron, vitamin A, and iodine deficiencies. And these are also common in disadvantaged populations. And then vitamin C, thiamine, and niacin deficiencies are often found in emergency affected populations. Nutrition assessment in emergency. So it's very important to understand the context of the emergency situation in order to develop an appropriate response. The standard methods that exist for conducting nutrition assessments at the outset and throughout an emergency are also put into consideration. So typically we have the rapid nutrition assessments and anthropometric surveys that collect information on the current situation, and also we have data from existing nutrition surveillance systems which can provide information on the pre-existing situation and also on trends. The responses, nutrition responses in emergencies. The typical responses to nutrition emergencies may include those that aim to prevent as well as treat undernutrition. So the responses that are aimed at preventing malnutrition include general food distribution and livelihood support. Under livelihood support, we have income and employment in form of cash transfers and cash for money or cash for work. Then production support in terms of seeds and tool distribution, seed fairs, fodder distribution, veterinary care and destocking. And then we also have market support in form of cash and voucher programs. The blanket supplementary feeding program, whereby we target all the population in order to prevent the occurrence of malnutrition. Then infant and young child feeding, focusing on breastfeeding protection and support, and minimizing the risk of artificial feeding, enabling appropriate and safe complementary feeding. Then we have health support in terms of provision of essential health services and then prevention and management of communicable diseases. Then micronutrient interventions, the provision of fresh food items, nutrient-rich commodities, or micronutrient fortified foods in a general ration. Also the distribution of food supplementation products. All these amount to the micronutrient interventions. Then we have the interventions in order to treat undernutrition in emergencies. And these include the therapeutic care, targeted supplementary feeding programs, and the treatment of micronutrient deficiency diseases. Planning and emergency preparedness. These are the foundations of effective humanitarian action, such as preventing malnutrition before it even starts, strengthening systems and strategies, tracking nutrition information, identifying and managing risks, and also directing a coordinated response. The importance of nutrition in emergencies, basically, we have two main objectives. One is to prevent death and also protect people's rights to nutrition. And when disaster strikes, people who are already malnourished before the emergency become more vulnerable to illness and death. So emergencies result in outcomes that can increase the risk of malnutrition, illness and death, and it is also very critical to protect the nutritional status of those affected. So people who suffer from acute malnutrition are far more likely to become sick and die. The highest rates of stunting have been recorded in Yemen, Pakistan, Afghanistan, in Sudan, in South Sudan, and then Djibouti, ranging from between 29.7% and 46.5%. And good nutrition is very, very essential in the promotion of good health and nutrition status and facilitating recovery. Some of the challenges we face in nutrition in emergencies. Even if there is a significant progress that has been made in the response to nutrition emergencies, still challenges remain, and some of these may include the lack of commonly agreed classification systems for nutrition crises, the proliferation of food-based products for treatment of acute malnutrition, and the lack of an evidence base for efficacy and effectiveness. Then we also have limited evidence for an effective model to treat moderate acute malnutrition. These challenges in implementation of the operational guideline or guidance on IYCF in emergencies. Then inadequate skills and expertise in nutrition in emergencies at national level. Then linking the relief, recovery and development efforts and also linking nutrition interventions with each other and with other sectors has been a big challenge. The key messages. So basically what we have to note is protecting the nutritional status of vulnerable groups affected by emergencies is very essential to prevent acute malnutrition, disease, and death. Several systems exist for the classification of food and nutrition crises. We have the IPC system, which is the one example that has been adopted by several agencies and governments to analyze and design responses to food insecurity. Nutrition emergencies are primarily caused by severe shortages of food, which are combined with disease epidemics, although we have underlying factors, for example, poor care and feeding practices, and insufficient access to health care, and also an unsafe environment. So although we have Asia and Africa that have suffered significant famines over past 100 years, food and nutrition crises still continue to persist, and many countries on both continents have baseline levels of acute malnutrition that indicate emergency response interventions are required. Acute malnutrition is a major concern during emergencies, but chronic malnutrition and macronutrient deficiencies are also issues in certain emergency-affected populations. A range of nutrition interventions are typically implemented in an emergency, both to prevent and treat acute malnutrition as well as support livelihoods. The existing challenges in the area of nutrition in emergencies include the lack of commonly agreed classification system for the crisis, limited evidence for an effective model, constraints to the operating environment, inadequate skills and expertise in nutrition in emergencies, and also linking the different programs together with the nutrition interventions. Thank you very much.